There's been a lot of change from the past to the present so far in terms of technology. For example, cars took the place of horse carriage and made traveling more efficient. Telephones took the place of letter writing and made communication more efficient. And now, even robots are enhancing the surgical procedures. But how is robotic surgery more beneficial than traditional open surgery performed by humans? 2 published primary sources and 1 published article were explored. The estimated effectiveness of robotic surgery compared to traditional open surgery. The advantages and disadvantages of robotic surgery were either experimented on or researched by the sources. Although each source took a different approach in establishing the benefit of robotic surgery, each one essentially concludes the same beneficial factors of robotic surgery. The 2 primary sources experimented with robots and gathered quantitative data on intraoperative and postoperative measurements, such as blood loss, surgery time, hospital stay duration, etc. On the other hand, the article displayed information on the Da Vinci robot's functions. In all the sources, it was concluded that robotic surgery presented many beneficial factors that surpassed the glory of open surgery performed by humans. In essence, robotic surgeries present many advantages relative to traditional surgeries.
What are the benefits of robotic surgery? Well, firstly, the actual operation time using the robots is shorter than traditional operation times. The robot's arms are usually thinner than a surgeon's arms. Thus, the arms of the robot and the camera usually do not interfere or collide into one another. There is greater maneuverability inside the surgery area. Due to this fact, a smaller incision is cut on the outside, so a large scar is usually not present in those that have undergone robotic surgery. Furthermore, a shorter recovery period is usually prevalent. Since the robot is able to work with much precision with less harm done to other body parts, the patient has less weakness to recover from. Thus, the hospital stay is also shorter, as the recovery period is shorter. Inside the body, blood loss is significantly less while employing robotic surgery compared to the open surgery. Post-operation, the complication and infection rates are lower while using the robotic surgery than open surgery. The robots are cleaned and sterilized very well before the operation is to take place. It is built of materials that lower germ infestation and enable a healthy environment inside the patient's body. Furthermore, since the operation time is shorter, there is a shorter time for bacteria to enter the patient's body through open areas. In addition, scar tissue is reduced in robotic surgery because of the fact that smaller incisions are cut to prevent the patient from suffering later. And that is why robotic surgery is more beneficial than open.
However, it is key to note that the robot does not necessarily replace the surgeon. Essentially, the robot's movements are controlled by the surgeon. Controllers and sensors collaborate the surgeon's force and movements and related to the robots. So humans are still essential, but the little complications are reduced due to the robots.